We could never underestimate what the staff have done on the schemes during COVID-19. They have had such strength, such compassion in the service that they delivered. They made sure that every single tenant still had as best a quality of life that they could have.
I don't think we understood what was coming our way. I think we had to just live day by day.
The tenants face challenges on a daily basis. This was just an extra challenge which had all of us on our toes. We knew we needed to step up. It was a learning curve for all of us.
As Director of Supported Living, I have responsibility for all the supported living schemes across Apex Housing Association. In total, there would be 1,221 tenants that would avail of those facilities.
Alexander House here is based in Bishop Street, and we provide accommodation for both sheltered tenants and those that need housing care.
Daleview House is a care of the elderly nursing home. It's individualised care because every person is having different needs and needs different support.
House in the Wells is a harm reduction hostel for adult males with alcohol issues and who would be homeless. Every day is different. We're here to support and see the residents through their journey.
Here in Woodbank House, we are a supported living unit for clients with complex mental health needs. These clients depend very heavily on us because we may be the only family they have, so we see ourselves as their family.
COVID-19 for supported living schemes was a very, very difficult time. In March 2020, all Apex staff right across the Apex organisation would have faced some of the most difficult and maybe fiercest challenges that they would have had. That would have been even more difficult for the staff that worked on our schemes within supported living. There was significant challenges for them.
It was just the unknown for everybody. Nobody knew what was going to happen and what could happen. One of the major problems was because most of our men have alcohol addiction, was getting their hands on alcohol at the start. If our residents didn't have their alcohol intake, they would have self-detoxed, then would have needed hospital treatment, and at that time nobody was really able to get into the hospital, so it would have been a lot worse for them.
We had deaths through COVID. It wasn't necessarily COVID related, but it had big impact. We had people that were palliative care that should have the service of GPs and things like that there that weren't coming out. You were fighting for them, you were being their advocate to try and get them the support that they needed.
We pride ourselves in one-to-one contact, so that threw up then the problem of social distancing. It was difficult for the tenants because they weren't used to seeing us in PPE, so we had nearly created a barrier, and that meant that we were extra vigilant about keeping contact with them.
Some of the schemes did experience significant outbreaks where there were deaths. We had staff who were the only people that could be with those tenants. They would have held their hands when they were dying because their families couldn't be there. They would have said prayers with them. And then they wouldn't have got the opportunity to say the goodbye to the tenants that they would have normally had in normal circumstances because they would have had to move on to another tenant in another room that was in the same situation and do the same for them.
In October 2020, I was diagnosed with COVID. I was in hospital for 5, nearly 6 weeks, completely on oxygen, unable to do anything for myself. I was catheterized, I had IV lines going, I had antibiotics, I had pain medications. I knew what it was then to experience being a patient in a really low time.
Throughout COVID-19, the staff were excellent. The skills and the knowledge of their tenants that they had and how they were able to work with their tenants to provide them with the best quality of life they could in a very, very restricted environment was fantastic. I can't praise them enough.
We have an amazing team here, and I think they should be celebrated. I think every team should be celebrated. Every scheme has had their difficulties.
A lot of our staff stepped up and done overtime, came in when they didn't have to come in, been there for the residents, just supporting them as they were supporting us, and it kind of brought us all closer together, the residents and the staff. We made a video for Christmas. It was just to show togetherness that we're all one on here. We're all going through the pandemic together.
After I had returned to work, it took several months of physiotherapy support through Apex. And that was one of the things that I know other people did not get How do you get back from not being able to do anything to doing what I do again today? It's a positive thing that Apex had done.
It's important that we never forget what those staff have done, and they continue to do. They haven't had the opportunities to have a break from it. They are coming out the other side of it, and it's lovely to go back on schemes and see that, and to see staff getting back out with the tenants and the families coming back in and visiting. It's really, really positive again to see that.
Looking back, I think we're just lucky to be still here and everybody's well and we've got through it, really, you know.
I can look back with great pride and say that we gave everything. We stepped up and done everything that we possibly could to maintain a safe environment for the tenants.
I think all staff should feel extremely proud of the service that they have provided, and hopeful that we will never have to provide some service like that again.